Unfortunately, last 15-20 days my health was playing truant, and unfortunately I could not see you, but thankfully now it's doing decent. Let's begin, and we'll try finishing this chapter today, and we will try making sure that gradually we speed up and try finishing economic survey as soon as possible. So when we talk about health sector, health is of course vital for human capital. अब ये health की importance, economic importance है, vital for human capital, and health is vital for economic growth, social development, and resilient economy and inclusive growth. So as India rises, we will need healthy population to be able to participate in activities. अब ये chart important है, ये सब लोग अच्छे से पढ़ लोगे. These are the 5 key pillars of health policy as economic survey suggests. So one is preventive health care. Preventive matlab not letting the disease happen. All right, that is preventive health care, making sure that the disease does not happen. So preventive health care mein kya hai? We have initiatives under National Health Mission. Another is early detection of ailments, better diagnosis, detecting it early. The earlier you detect an ailment, larger are your chances of solving it. So National Program for Prevention and Control of Non-Communicable Disease. Non-communicable disease का मतलब क्या हुआ? Non-communicable disease will be things like diabetes or cancer or hypertension, obesity. These are all non-communicable disease. ये आप communicate नहीं करते, ये lifestyle के वजह से होती हैं. All these diseases are because of lifestyle. So that is non-communicable disease. And then of course there is free and low cost medicine available. PM Jan Arogya Yojana for insurance and Jan Aushadhi Kendras to sell generic drugs at cheaper rate. So that is to make even important drugs available to all at a cheaper rate, and that all is playing its own role. And then there is availability of doctors in rural areas. So the government has been working on sub-centers, primary health centers, community health centers, and then expansion of technology in health. So it is, Ayushman Bharat Digital Mission, UWIN portal, इनके बारे में हम अभी गौर से डिटेल में पढ़ेंगे अभी, and e-संजीवनी. तो क्या 5 चीजें हो गई जिनको सरकार बोल रहे हैं pillar of health policy: prevention, early detection, free and low cost medicine, availability of doctors in rural areas, and expansion of technology in health. So if you are writing any answer on health, try incorporating these 5 pillars that the government is using for promotion of health care. Then of course, if we look at our national health accounts, the total health expenditure in fiscal year 22 is estimated at around 9 lakh crore. This is including central government and state government. This is also including expenditure on Swachh Bharat Yojana, Jal Jeevan Mission, जो health से connected हैं. तो ये सिर्फ medicine और इलाज की बात नहीं हो रही, ये prevention की भी बात हो रही है ताकि कैसे health को बेहतर बनाया जा सके. So of course, 3.8% of GDP is what India spends on health, and 6,602 rupees per capita at current prices. Now what we have seen is, since 2019 till 2022, the trend has been increasing. But again, from your prelims point of view, remember, the trend was decreasing for 2 years, 17-18 and 18-19, when the overall expenditure on healthcare became relatively lesser in per capita terms. As a percentage of GDP also, it fell in 17-18 and 18-19, but from 19-20 till 21-22, it has been rising as suggested by economic survey. तो याद रख trends को रखना है. Then if you see the capital expenditure is expenditure on producing further production capacity. So the capital expenditure in total health expenditure rose from 6.3% in 16 to 12.7% in 22. So capital expenditure का share double हो रहा है, जैसे ventilators arrange करना, hospitals की building बनाना, that is capital expenditure. Equipments, machines, diagnostic machines, that is capital expenditure. And from 1.14 trillion rupees, the progress has now expanded to 7.9 trillion rupees. एक और अच्छी बात क्या देखने को मिली है, that the government health expenditure is rising as a share of total health expenditure, and out of pocket expenditure is falling as a share of total health expenditure. Out of pocket expenditure is expenditure done by people on getting cured, कि जो एक्सपेंडिचर लोग लगाते हैं अपने आप को क्योर करने में, दैट इज कॉल्ड आउट ऑफ पॉकेट एक्सपेंडिचर. तो आप सोचिए फिस्कल ईयर 2015 out of pocket expenditure was 62.6% and by fiscal year 22 it is 39.4%. Now that's a very good progress on our part. अगर अगले आप चार्ट पे आएंगे तो यही क्लैरिटी से दिखेगा. अब देखिए इन 2013-14 our out of pocket expenditure was 64.2% and government health expenditure was 28.6%. This has shown a rising trend reaching 40.8% by 17-18 and 48% by 2021-22, while out of pocket expenditure has shown a declining trend at 39.4%. The rest of the expenditures are actually by either insurance companies or they are by self-help groups on their members. So the number is not adding up to 100. Then if we see the trends in health expenditure as a percentage of GDP, health expenditure in 2014-15, out of pocket expenditure was 2.4% of GDP. Now it has come to 1.5%, while in 2014-15, government expenditure was 1.1% of GDP. Now it is 1.84%. तो पहले हम 3.43% of GDP खर्च कर रहे थे हेल्थ पे, जिसमें more than 70% was or 65% was out of pocket. Now still we are spending 3.35% on health, but now less than 50% is out of pocket expenditure. Then if we see what has the government done, so increased government spending of kya hai? This is benefit generated by reduced out of pocket expenditure and methods used. क्या methods use किए गए हैं और क्या benefit generate किए गए जा रहे हैं by reduced out of pocket expenditure. तो पहला, it has eased financial burden on households, especially like lower middle income groups, जिनके लिए एक खराब हेल्थ उनको पॉवर्टी तक लेके जा सकता था. आप समझ के देखिएगा ये बात. इसे सेकेंडरी पॉवर्टी implication कहते हैं. Suppose I am someone poor, I have worked hard, I have taken myself out of poverty, but I don't have enough savings and I am dependent on my wage income. If God forbid I go unwell and I go for my medication, if my out of pocket expenditure is very high, it will mean that I am already losing then on my savings, plus because of long illness I have lost my job, and that will mean I have lost my income source and I can be pushed back into poverty. So if we can do preventive health care and if we can restrict out of pocket expenditure, we will be successful in controlling secondary poverty instances. So that is also very important. So coming back to this, we say that how is the government doing it? Social insurance schemes like Employees State Insurance Corporation, Central Government Health Scheme and Ex-Servicemen Contributory Health Scheme. तो इन सब से गवर्नमेंट कोशिश कर रहे हैं आउट ऑफ पॉकेट एक्सपेंडिचर कम करने का. एंड देन पीएम जन आरोग्य योजना एज द इंश्योरेंस स्कीम वॉलंटरी ओवर पीपल. देन देयर इज टिल्ट टुवर्ड्स प्राइमरी हेल्थ केयर. क्यों? इट इज अ कॉस्ट इफेक्टिव वे. लेस कॉस्ट में आप हेल्थ के बेनिफिट्स बढ़ा सकते हैं और बेटर केयर दे सकते हैं. शेयर ऑफ प्राइमरी हेल्थ केयर, ये इंपॉर्टेंट है, ध्यान रखोगे, इन गवर्नमेंट हेल्थ एक्सपेंडिचर rose from 51% to 55.9% and primary and secondary together increased from 73 to 85.5%. It also shows focus on prevention, prevention and early diagnosis. इनसे लोगों का ज्यादा भला होता है. Prevention and early diagnosis. Then of course the share in private health spending declined from 83% to 73.7%, shifting that government facilities are now being used more for primary care. Then if you see, infant mortality declined from 39 in 2013 to 28 per 1,000 live birth, and maternal mortality declined from 167 in 2014 to 97 in 2020. India has already reached the Millennium Development Goals in these, and now we are in sync to reach the Sustainable Development Goals on both of these. ये भी ध्यान में रखेंगे आप. That infant mortality rate has gone down, maternal mortality rate has gone down substantially in Indian context, and we are on track of reaching these goals. Then role of, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, that is ABPMJAY, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. एक बात क्या याद रखोगे, largest health insurance system covering 40% of vulnerable population of approximately 55 crore individuals, offering up to 5 lakh per family, plus all people in India above 70 years of age. तो ये वर्ल्ड का हाईएस्ट और लार्जेस्ट हेल्थ इंश्योरेंस प्रोग्राम है इन टर्म्स ऑफ नंबर ऑफ पीपल इन्वॉल्व्ड, कि जितने लोगों को ये कवर कर रहा है, पूरी दुनिया में कोई भी ऐसी सिंगल हेल्थ इंश्योरेंस प्रोग्राम नहीं है जो ये कर रही हो. सो इट इज द लार्जेस्ट हेल्थ इंश्योरेंस सिस्टम covering 40% of vulnerable population and offering up to 5 lakh per family annually for secondary and tertiary care. For secondary and tertiary care. Primary के लिए नहीं है आयुष्मान भारत जन आरोग्य योजना, secondary and tertiary के लिए है. Now more than 36 crore Ayushman cards have been issued, 30,000 hospitals have been impaneled, out of which 13,000 plus are private facilities, 49% of card holders are women, and 48% of hospital admissions are utilized by women. So the vulnerable groups like women have been able to take better advantage of Jan Arogya Yojana. As I told you, has been expanded to cover all citizens of 70 plus, regardless of the income. So it benefits an extra 6 crore seniors with the coverage. Treatment will cost 1.5 to 2 times less than private health care. So the poor and deprived families have been saved over 1.25 lakh crore in out-of-pocket expenses. So the benefits and the scheme Jan Arogya Yojana, ये ध्यान रखोगे, almost हर साल सरकार इसके बारे में बात करते हैं, कभी भी prelims या mains में ये पूछा जा सकता है at any point of time. Then of course we see health insurance and impact on credit market outcomes. ये case study दिया है सर्वे ने. ये case study ये बताता है कि पीएम जन आरोग्य योजना के आने से पहले और आने के बाद क्या इम्पैक्ट पड़ा ऑन द नॉन परफॉर्मिंग एसेट रेट्स बाय द माइक्रो फाइनेंस कंपनीज. दैट इज जो छोटी कंपनीज लोन देते हैं, जेएवाई आने और आने के पहले और बाद क्या असर पे, व्हाट वाज द इम्पैक्ट बिफोर इट, आफ्टर इट. द आइडिया इज इट possible that when you save health expenditure of the people, they can pay back their loans better, their requirement of taking new loans is less, and that makes the whole economy better off. So we see that a comparative study of contiguous areas is areas closer to each other, जो जुड़े हुए हैं आपस में area, contiguous areas with and without PMJAY implementation. उसने ये बताया है that the implementation of Jan Arogya Yojana, जो insurance मिलता है लोगों को, led to a 3.7 to 4 percentage point reduction in NPA rates for microfinance loans. That's a 34% decrease in default. तो ये हो गया एक benefit of PMJAY. ये भी देखा गया that similar reductions were observed in agricultural loans. तो ये बताता है कि अगर health insurance मिले तो financial stability ज़्यादा मिलेंगी. So government can improve the healthcare access, but the health outcome will, ये बहुत important है, the healthcare access can be improved, but आप जब जाएंगे अस्पताल मतलब आप बीमार हो चुके हैं. You know, if you're going to the hospital, you are already ill. तो बचाने का क्या तरीका है? It will depend on sanitation, education, nutrition, and early childhood development, so that the possibility of you falling ill can itself be reduced. Then we go further. We see healthcare infrastructure for tomorrow that the government is talking about. So we talk about hospitals, clinics, professional institutions and IT systems to make sure quality medical services are available. So India has significantly improved health infrastructure through medical advancements and expanded public health programs. इसमें example again आयुष्मान भारत से शुरू किया इन्होंने. Launched in 2018, this shifted from selective care to comprehensive health care. ये important है कि ऐसा नहीं कि कुछ ही जगहों पे आपको केयर मिलेगा, एक comprehensive health care होगा जिसमें community wellness centers भी बनाए जाएंगे as primary health care, then secondary health care रहेगा और साथ में आयुष्मान आरोग्य मंदिर भी बनेंगे. उसके अलावा you will also get insurance. Then they talk of course about the component. Now this is for you to just go through. ये basic idea है कि कितने लोग enrolled हैं और number of footfalls कितना है, hypertension की screening कितनी है and all. इसका बस आप एक idea ले लेंगे. Then of course they talk about the PM ABHIM with respect to Ayushman Bharat Health Infrastructure Mission. So if we look at, launched in October 21, PM ABHIM aims to strengthen public health infrastructure. तो पहला ये public health infrastructure को strengthen करे. Surveillance से क्या होगा? Faster diagnosis and prevention. And then research से क्या होगा? New medicines, cheaper medicines, better diagnostic centers and so on for across urban and rural areas. तो यहाँ हमने देखा कि सब सेंटर ऑफ हेल्थ एंड वेलनेस सेंटर्स कितने अप्रूव हो गए. अगेन इट्स अबाउट क्रिएटिंग न्यू इंस्टीट्यूशंस टू मेक श्योर दैट इवन इन द ब्लॉक्स, इवन इन रूरल एरियाज वी हैव इनफ सपोर्ट फॉर बेनिफिट्स फॉर पीपल. तो पहला हुआ पीएम ABHIM. आप याद रखेंगे हमारी बात क्या हो रही है यहाँ, दैट हेल्थ केयर इंफ्रास्ट्रक्चर के लिए सरकार ने क्या क्या किया है. तो क्या क्या किया? पहला पीएम ABHIM. दूसरा फ्री डायग्नोस्टिक सर्विस इनिशिएटिव प्रोग्राम. This free diagnostic service initiative program was under National Health Mission to reduce out-of-pocket expenditure. इसका एक और फायदा क्या है कि लोगों को encourage करता है कि जाके पता करें कि मैं बीमार हूं या नहीं. We have been a poor country, so there has been a culture in our country to delay getting cured. और जब delay हो जाता है, then it becomes more difficult for people to get cured. So with things like PM ABHIM, with Jan Arogya Yojana and with things like free diagnostic services, it is possible that there will be a possibility of early diagnosis, and it funds states and UTs to provide 106 to 381 drugs across hospitals and testing at NABL accredited labs. Then universal immunization program, ये 1985 में launch हुआ था. अगर आपको याद हो, इसमें 2015 में गवर्नमेंट ने इंट्रोड्यूस किया मिशन इंद्रधनुष और अब गवर्नमेंट इसको एक्सपैंड कर रहे हैं. तो दिस इज फॉर 12 डिजीज, as they say, over 11 vaccines against 12 preventable diseases, and with 93.5% immunization coverage in fiscal year 24. तो अब 12 डिजीज को कवर कर रहा है और गवर्नमेंट अब कह रहे हैं that कोविन ऐप will be used, and this कोविन ऐप will be used now to make a record digitally through this digital public infrastructure to check how many people have been covered. Then of उसको U-Win कह रहे हैं, अभी बात करूंगा मैं उसकी. Then of course there is Jan Aushadhi scheme. This is cheaper medicine. The Jan Aushadhi scheme is cheaper medicine. This is generic drugs. So these generic drugs, ये salt same होते हैं, बस बड़ी कंपनीज और बड़े ब्रांड्स के नहीं होते. So people will get, and there are more than 14,000 Jan Aushadhi Kendras making sure that people get affordable medicine. Then quality is a concern and pharmacists profit less, but the good is the product offerings are still making sure that those who are suffering from illnesses are getting supported. Now, Ayushman Bhava campaign, this has been started from September 23. ये अगला पॉइंट आप ऐड कर सकते हैं एज गवर्नमेंट स्ट्रक्चर क्रिएशन. दैट इज टू सैचुरेट सेलेक्टेड हेल्थ केयर सर्विसेज. सैचुरेट का मतलब है प्रोवाइडिंग फॉर ऑल. सैचुरेट हेल्थ केयर सर्विसेज का मतलब सभी तक ये पहुंच सके, सभी गांवों में, सभी टाउन में, सभी लोगों तक. And inform citizens about government's flagship schemes, and conducting yoga and meditation sessions, teleconsultations, immunization for mother and child, to make sure again prevention. तो जब भी preventive health care पे आंसर लिखोगे, you can talk about आयुष्मान भाव campaign, curative में जन औषधि, preventive में PMA भीम, that kind of thing you can always make. Then of course if we see technology enabling seamless and equitable health care, तो क्या initiatives लिए उन्होंने? पहला U-Win. What is this U-Win? It digitizes immunization records, कि जो आपने इम्यूनाइज किया लोगों को, वैक्सीनेट किया लोगों को, उसके रिकॉर्ड को डिजिटाइज कर देता है. सो इट डिजिटाइजेस इम्यूनाइजेशन रिकॉर्ड्स फॉर प्रेग्नेंट वुमेन एंड चिल्ड्रन अंडर 16. ऑलराइट, दैट इज वन थिंग दैट इट डज, कि सारे इम्यूनाइजेशन रिकॉर्ड को डिजिटाइज करेगा. प्रोवाइड्स फ्लेक्सिबिलिटी, जैसे ही पता चला कहीं पर लोग नहीं इम्यूनाइज हुए हैं, जल्दी आप चेंज कर पाएंगे अपने पॉलिसीज को. सेल्फ रजिस्ट्रेशन इनेबल करता है, सो पीपल कैन सेल्फ रिपोर्ट दैट आई हैव बीन इम्यूनाइज्ड, डोंट वरी. Scheduled tracking, so everybody, the tracking part can be in district headquarter to find out if everybody in a given village, given township has been immunized or not. SMS reminders to people to make sure they have been immunized, and QR based e-vaccination certificates. It is available in 11 languages to make it friendly for people, and has already registered more than 1.7 crore pregnant women and 5.4 crore children. So that is about the thing that India is doing. ये जरूर अपने आंसर में mention करना. U-Win is actually a very good beginning by government of India for bringing back immunization on track. Then e-Sanjeevani, again a digital public infrastructure. This is the world's largest telemedicine service. It has provided care to 31 crore patients through 1.29 lakh AAM centers, supported by 16,447 hubs, 676 online OPDs, and 2.25 lakh healthcare professionals. Again, this is important. अपने answers में e-Sanjeevani जरूर लिखो. e-Sanjeevani क्या है? World का largest telemedicine service, making sure it reaches out to people even in remote areas. And then Ayushman Bharat Digital Mission. इसके अंदर इंटीग्रेटेड हेल्थ इंफ्रास्ट्रक्चर से ये फैक्ट शीट आपको दिखेगा that Ayushman Bharat Health Asset created 72.8 crore, health records linked 47 crore. अब health record link से क्या होगा और health अटेस्टेशन से क्या होगा? We will have record. अब मान लीजिए अगर मैं बीमार पड़ूं, अगर एक जगह मेरा सारा रिकॉर्ड है, the doctor just has to click on a mouse and get all my background check, everything. So that ways, if I am allergic to something, or if I have suffered from some other illness earlier, everything will be there, which will make it easier to treat people. You know, that is the basic idea here. Then of course, there is a case study they give on aerial angels on leveraging drones. ये है use of drones in healthcare. तो अगर कभी तुम कोई आंसर लिखते हो, तो यूज ऑफ ड्रोन्स इन हेल्थ केयर पे एरियल एंजल मिशन को लिख सकते हो. तो एरियल एंजल्स हैं कौन? वो कहते हैं that this is about enabling rapid delivery of medicines and medical supplies to remote and emergency prone areas. That is the idea of aerial angels. Remote हैं, disaster prone हैं, deep inside forest and all हैं. So drones can be used for rapid delivery of medicine. From Sky, that is Telangana 21 and Arunachal Pradesh 22, and iDrone ICMR 21 have demonstrated their effectiveness and reducing delivery times from 8 hours to 22 minutes in case of Arunachal Pradesh. ये examples तुम लिख सकते हो about drones playing a role in improving telemedicine availability. Then of course the key statistics about iDrone. It has done 130 hours of flight time already. 65 health centers are connected. 22,000 medical essentials have been delivered, and 7,700 kilometers are already. And ये बस beginning है अभी. Imagine the numbers we will see 10 years later or 8 years later as this technology becomes more and more pronounced. Then of course, this I have already told you that it enhances emergency response and transport vaccines, sample collection, and so on. So that will help in building up a good healthcare इंफ्रास्ट्रक्चर. तो पीछे जितनी बात आप पढ़े वो सारा कुछ हेल्थ केयर इंफ्रास्ट्रक्चर पे था. अब वापस एआई आ गया. आप देख रहे हैं हर चैप्टर में यूजिंग एआई टू स्ट्रेंथन थिंग्स. पक्का रखो यूपीएससी जाएगा इस दिशा में इस साल. दैट आर्टिफिशियल इंटेलिजेंस से सवाल पूछेंगे कि कैसे उसका यूसेज है. मेंस में तो जरूर आना चाहिए, प्रीलिम्स में भी आ सकता है. सो इफ वी टॉक अबाउट this formulation, we say Niti Aayog's strategy for artificial intelligence highlights AI's potential to address health challenges. So the idea is combine AI with robotics and Internet of Medical Things. Internet of Medical Things is different medical equipments connected via internet, so that one medical equipment can give an instruction to another that, okay, this is your next turn, you have to do this, and so on. That is Internet of Medical Things. Smart medical equipments, that is. So a new nervous system for healthcare has been created that way. So AI adoption, अब ये benefits हैं. पहला, AI adoption can reduce drug discovery costs. जल्दी आप drug discovery कर पाएंगे. Second, it can enhance medical device quality. Third, support personalized and preventive care. And fourth, bringing the accessibility, affordability, bridging it, sorry, and quality gaps. क्योंकि AI क्या करेगा? हमें टारगेट करने में मदद करेगा. ये पक्का करेगा that bots बना दीजिए, लोगों से चैट कर लिए, पता कर लिए उनकी क्या दिक्कतें हैं, या AI के थ्रू solutions निकाले, personalized. So that is what AI can do. And there's a case study they give, use of teleradiology and AI in silicosis management. So silicosis, I'm sure most of you would have heard, is a severe lung disease and happens near the sandstone mining areas. And the state government, what it has tried is AI-driven digital X-rays have been done, and teleradiology has been done for faster, more accurate diagnosis. So in states like Rajasthan, where there has been a lot of incidents of silicosis because of the sandstone mining and all, the state government uses AI and teleradiology for faster diagnosis. And then AI model trained on chest X-rays enables automatic detection, improving patient identification and treatment. And remember, the direct benefit transfer self-approval portal ensures that financial aid to diagnosed patients can reach without any hassle. Of course, then another thing is e-Swasthya Dham portal. This has been launched by Uttarakhand government. Take this as another example. So, एक Rajasthan government, silicosis, एक Uttarakhand government over here, launched by Uttarakhand government to monitor Char Dham Yatra pilgrims, enabling quick Ayushman Bharat health account generation for secure digital health records. It ensures timely medical assistance for pilgrim safety and convenience. And then right now the survey says that there are data complexities, it's a nascent stage, but as we upgrade it, as we scale things up, there are promising days ahead. Then we talk about impact of lifestyle choices on health. NCDs are non-communicable disease, that is NCD. Again, survey talks about how lifestyle can affect things. So, diet, sleep, device use, exercise, they all play a critical role. And survey says 41 million deaths annually, with 77% occurring in low and middle income countries, is what WHO said are due to NCD. In India also, the NCD related deaths have increased from 37.9% in 1990 to 61.8% in 2016, mainly due to cardiovascular disease, cancer, and so on. That means we have to look at people's diet, activity, tobacco consumption, alcohol use, to make sure that people don't suffer from these diseases. Information is the key, and conviction among people to get rid of their unhealthy habits is another important factor. इसको address करने के लिए Ministry of Health and Family Welfare has launched the NP-NCD program, strengthening healthcare infrastructure. Now see, the healthcare infrastructure developed under National Policy for National Non-Communicable Disease, 770 district level clinics have been established at district health headquarters. 6,410 community health centers have been established as NCD clinics. तो ये आप ले सकते हैं efforts made to control non-communicable disease. साथ में for timely intervention and reducing burden, individuals above 30 plus are targeted for detection because chances they might catch one of these diseases is high. And the portal integrates patient data with Aadhaar IDs to make sure that 42.2 crore people have been enrolled and 39 have been screened for diabetes, hypertension and other things. क्योंकि देखिए जो better off लोग हैं उनको फिर भी symptoms पता चलते हैं, वो जाके चेकअप करा लेंगे, but जो relatively less better off हैं, they need to be supported here even more so. Then if we see There is a case study about ultra processed foods. You can read through that, but this is mainly about the factor that the rise in ultra processed foods like potato chips and those popcorns and food served in restaurants. So these ultra processed foods are giving rise to more non-communicable disease, and it is a direct correlation survey has established between the use of ultra processed food and the rise in non-communicable disease in India. Then of course, so they say that the low fiber content lead to weight gain, which again increases the risk of multimorbidity and so on. So they say that India has introduced policies like advertising and claims regulation, school children regulation, food safety and standards regulation, Consumer Protection Act 19 for misleading advertisement. Again, this is important about the steps taken legally to prevent the use of ultra processed food. But this survey says that misleading marketing through ads and endorsements, countries like Brazil, Canada, etc. use nutrient profile model. ये जरूरी है कि कभी कभी लोग क्या करते हैं, वर्ड्स के पीछे छिप जाते हैं. जैसे बोलेंगे zero diet coke, zero sugar, but actually it's not zero sugar. It's having still a lot of sugar in it and a lot of sugary content. तो लोग अपना सोच रहे हैं पी के कि मैं तो zero sugar पी रहा हूँ, but actually वो zero sugar नहीं पी रहे. So that's about hiding behind the technicalities and not showing the actual content that the product might have. So that is what they are doing, and then raise consumers awareness by popularizing local, seasonal and whole foods through positive subsidies. तो हेल्दी खाने को सब्सिडी दीजिए और अनहेल्दी खाने पे टैक्स ज़्यादा लगाइए ताकि लोग नॉन कम्युनिकेबल डिजीज से बच सकें. That is the basic idea. Then of course there are stronger policy interventions. Ministry of Health and Family Welfare can set nutrient thresholds. ये दूसरा काम सरकार कर सकते हैं. And enforce front of the pack warning labels. कि आप वार्न कीजिए कि इस फूड से क्या क्या गलत हो सकता है. Public areas like hospitals and schools, ultra processed food free. And then enhancing regulatory oversight, making sure that apart from FSSAI, the strict measures against aggressive advertising and promoting healthy lifestyle. तो ये आपको ध्यान रखना है अगर बात हो कि नेशनल नॉन कम्युनिकेबल डिजीज के लिए अल्ट्रा प्रोसेस्ड फूड हटाने को सरकार ने क्या क्या किया है. Then we talk about mental health. Now economic survey 24 talked about mental health. This is from there. And economic survey 25 also talked about mental health. So we have a lot of talk on mental health happening in economic surveys. So remain very conscious about that. A lot of talk on mental health that is happening at the moment. So we see mental health is a crucial yet often overlooked driver. लोग इस पे ध्यान कम देते हैं. तो उस केस में we talk about how people can be given mental health. So what are mental health conditions? They can range from minor stressors to severe disorders, and that is why individuals can be affected for life. So rising prevalence of mental health में WHO ने बोला over 970 million people, that's 1 in 8 living in the world, have some mental disorder or the other. And in 2020, due to COVID, there was a 27% rise in depression and 25% rise in anxiety. So that is what we are facing today. That and remember, ये तो वो लोग हैं जो diagnose हो पाए. बहुत सारे लोग हैं जो diagnose भी नहीं हो पाते. And due to that lack of diagnosis, the suffering is acute for a very long time in life. Then of course, and social stigma and all play their own bad impact. So National Mental Health Survey 2015-16 बताता है that 10.6% adults suffered from disorders. And again, remember, this is people who could report. And we saw that urban metro, there was a lot of prevalence of mental morbidity, people dying because of mental health. But इसमें एक बात का ख्याल रखिए, ये urban में नंबर ज़्यादा इसलिए दिखता है क्योंकि लोग रिपोर्ट ज़्यादा कर देते हैं. रूरल और नॉन मेट्रो में ये पता भी नहीं चल पाता. So evolving mental health of children and youth. अभी हम देखते हैं child and adolescent health is a major challenge. अभी कुछ दिन पहले कोई मुझे बोल रहे थे कि सर 10th में पढ़ाई इतनी टफ है कि बच्चे सुसाइड करते हैं. पढ़ाई टफ नहीं है, वो औकात तो आपको और मुझे पता है कि पढ़ाई की कितनी औकात है, बट सोसाइटी इतनी टफ हो जाती है, सब लोग इतना उसका एक फ्यूरॉर क्रिएट कर देते हैं जब बच्चे सुसाइड करते हैं. हम ध्यान ही नहीं देते कि उनके मेंटल हेल्थ पे क्या असर पड़ रहा है. एंड द ट्रेनिंग इज नॉट इन 10th, द ट्रेनिंग इज फ्रॉम बिगिनिंग. वी हैव टू ट्रेन आवर चिल्ड्रन, द यूथ, that you can work hard as if there is no tomorrow, but then the results are not in your hand, so don't worry. So that is the basic bottom line of it. Anyways, we see that globally 1 in 7 10 to 19-year-olds experience mental disorders, and that's a challenge. And NCERT's survey on students' mental health revealed that among adolescents, 11% reported anxiety and 14% reported extreme experience and 43% mood swings. So this is something to get worried about, because remember, cyberbullying is happening a lot in our country, doom scrolling is happening, media use is there, negative news is published more than positive news. So many of us have acute sufferance which we sometimes don't even realize. See, what is the challenge today's world is facing? मैं हमेशा बोलता हूँ कि हमारे जनरेशन के लोग कभी कभी आपको बोलते हैं भाई तुम्हें तो नहीं होता, हमें तो नहीं होता था कोई मेंटल हेल्थ है, तुम्हें क्यों होता है? पहली बात, हमें भी होता था, हमें पता नहीं चलता था. दूसरी बात, हमें कम इसलिए होता था बिकॉज वी वर नॉट एक्सपोज्ड टू इंफॉर्मेशन वर्ल्ड एंड ओपन प्रेजेंटेशंस एज मच एज यू आर. तुम्हारा एक रिजल्ट इंस्टाग्राम पे है, फेसबुक पे है, ट्विटर पे है, तुम ज्यादा प्रेशर में हो. हमारा रिजल्ट बहुत से बहुत पड़ोस की एक आंटी आ जाएंगे नाक घुसाने के लिए, तो हमें लगता था चलो एक आंटी से छुटकारा पाना है. तुम्हें तो पूरे इंस्टाग्राम से छुटकारा पाने की नौबत आती है. एंड देन एवरीबडी इज पोस्टिंग देयर ग्रेट पिक्चर्स एंड ऑल, सो द माइंड फील्स ओ एवरीबडी इज डूइंग ग्रेट and I am not doing that great. So all that has its own impact on mental health, especially for kids who may not be well programmed. And then screen has its own impact on mind. जो भी लोग ज़्यादा screen time रखते हैं, कहीं ना कहीं उनका mental health खराब होता है, because it affects the sleep cycle, it affects my thinking process, analytical capability. और रही सही कसर तो ChatGPT और बाकी के जितने generative AI हैं वो पूरा कर ही रहे हैं. So this is something that where our kids are quite in threat. As I told you, increased screen time, overprotective parenting, reduced free play, all have disturbed the mental health that we see here. In fact, the Surgeon General of US, Vivek Murthy, likens social media to tobacco, advocating for warning labels and law to protect youth from online harm. Australia ने law भी बना दिया है regarding school students getting accessibility to their screen timings. So these are the reports they give us. Then we talk about lens of economics, that what does mental health issue does on economics. First, reduces individual potential and economic productivity. And second, increases healthcare costs. Mind you, when we are mentally unwell, we are physically unwell. Don't forget that. हमारा माइंड हमारी बॉडी पे रिफ्लेक्ट करने लगता है. तो मेंटली अगर मैं हेल्दी नहीं हूं तो मेरा फिजिक जो है वो भी उसको इंटरनलाइज करने लग जाएगा. देन ऑफ कोर्स देयर विल बी पॉवर्टी, urbanization and migration further elevate psychological distress. People are poor, living in an urban space where they are individually living, migration, not living at their home, all that elevates it. And then investing in mental health yields high returns. Global estimates increase 3.3 to 5.7 benefit to cost ratio. अगर आप ₹1 मेंटल हेल्थ को ठीक करने को लगाएंगे तो कम से कम 3.5 rupees का बेनिफिट तो जरूर मिलेगा. So this is the economics of mental health. Then of course the lifestyle and work culture, they have their own mental health impact. We need to make sure that work culture improves and encompasses individuals' experience, work amount, load, how much can people actually take, manager and peer relationships. And then it is important that employees have pride in what they work in. That is where diversified training possibility, multiple job. मान लीजिए मैं फुटबॉलर बनना चाहता हूँ, आपने मुझे सरकार में क्लर्क बना दिया, मैं नाराज रहूंगा, mentally disturbed रहूंगा, लोगों पे एंगर निकालता रहूंगा. So if we can create a structure in India where a budding footballer can get multiple teams to select him or her and then let them become a footballer in future, have a basic lifestyle, and then live their life, that can go a long distance in solving mental problems. That is a key factor. Then of course we also see that people who are fully remote workers, they report 17% lower well-being. Why? Because they have no accessibility to their loved ones, they are not able to interact with people, they don't talk much to people, all that distracts them downwards. Then of course we see excessive work hours, 55 plus week. It's paradoxical I am teaching this, but anyways, excessive work hours 55 plus per week and prolonged desk time 12 plus hour, significantly lower mental well-being, reinforcing the need for balance. ये on an average देखा गया कि humans की capability कितनी है. उसमें एक बात का ख्याल रखिएगा, on the 70 hours work debate by Narayan Murthy ji, the talk should be what is the capability of individual human doing things compared to what other average humans can do. So Sachin Tendulkar can play cricket for 25 years. That doesn't mean a cricketer's average life is 25 years. So if somebody says cricketer's average life is 10 years, then you can have exceptions like a Sachin Tendulkar or a Sunil Gavaskar or a Virat Kohli or a Kapil Dev who may outgo, but then remember they were geniuses. So we should not be comparing geniuses to average. So average is 55 hours, average is a given work condition. Then individual humans are individually made, they do things as they are and they are programmed like that. Then of course we talk about impact of lifestyle. अल्ट्रा प्रोसेस्ड फूड खाने से भी मेंटल हेल्थ आना शुरू हो जाता है. तो जो लोग भी चिप्स खाते हुए मेरा ये YouTube प्रोग्राम देख रहे हो वो थोड़ा संभल जाओ. Then of course the junk food have mental well-being will be disturbed. Those who rarely exercise, spend their free time on social media, not close to the family, will also have worse mental well-being. ये points याद रखेंगे. Why do we have bad mental well-being? What are the steps that have been taken by the government and what should we do to improve it? इस तरह से एक स्ट्रक्चर तैयार कर लो, एक पेज पे आंसर लिख के रख लो, इनको यूज करके you will be better off if by chance suddenly a question comes on mental well-being in our answer writing. Then of course we come on impact on productivity. So we see that mental well-being and days unable to work per month goes on rising. The mental well-being score जितना ज़्यादा होता है, inability to work days उतने कम हो जाते हैं. Then of course we also see policy and initiatives. तो government ने district mental health program establish किया है. The purpose is central funds to districts under the national health mission to integrate mental health with primary health care. और primary health care workers को train किया गया है, awareness campaigns किए गए हैं. Second, national tele-mental health program to make sure toll free number हो counseling के लिए, और 1600 trained counselors बनाए गए हैं to again make sure mental health can be taken care of. राष्ट्रीय किशोर स्वास्थ्य कार्यक्रम, holistic development of adolescents, school going children, children in the pre-puberty stage, and adolescent friendly health clinics have been established. And then Manodarpan is about sensitizing, training and health wellness ambassadors. तो teachers को training दी गई, teachers बनाए गए ऐसे जो wellness ambassadors बने, training ambassadors बने, सभी लोगों को गुरुजी के पास ना जाना पड़े, कुछ लोग प्रोफेशनल के पास जाके भी अपने mental health को sort out कर लें. And emotional well-being and mental health module developed by NCERT. But remember, all this will work better only when we inform people about the relevance and importance of mental health in a person's life. That's very important. We need to make sure we are happy, we are in a good zone, we mentally feel, enthusiastic without taking anything that sets us on a high. So if we can do that, that kind of training, compassion, forgiveness, understanding, joking, all that keeps us happy and energetic is where the feature should be. Then there are other steps like NCERT counseling service, CBSE pre and post program telecounseling, and initiatives by state governments for state mental health policy in Meghalaya and Delhi. The policy recommendation is 1. Increase the number of psychiatrists. We have at the moment not even 1 psychiatrist per 1 lakh population. WHO says it should be at least 3. Then comprehensive service guidelines for health professionals, take user feedback on existing program and create peer support networks. The first people who will highlight you have a challenge are people who are nearer to you. Then of course collaborating with NGOs, integrating mental health into schools, etc. Standardizing the guidelines, सबको पता हो कि symptoms क्या हैं, cure क्या है, challenges कैसे sort out करें, and developing an age appropriate mental health curriculum for teachers and students. Age appropriate is a young kid might throw some other tantrum, but an elder kid might have some other challenges. So if you create an age appropriate system, you will do very well for yourself. Way forward on health is 2 key trends are shaping India's health profile. 1, prioritizing healthy eating and mental health, and 2, strengthening state level governance, because end of the day it is the state government, जो मैं क्लास में भी तुम्हें हमेशा बोलता रहता हूँ, which will create the effective health program. Then of course obesity and diabetes rates are rising, which is a challenge. So with obesity increasing from 20 and 18% in men and women to 24 and 22%, the National Family Health Survey shows that an effective state and local governments is therefore crucial. Then we move further to rural economy. So healthcare पे ये चीज़ें important हैं. आप इंक्लूसिव ग्रोथ में इसका काफी यूज कर सकते हैं, सोसाइटी के आंसर्स में यूज कर सकते हैं, गवर्नेंस के आंसर में यूज कर सकते हैं. सो दे विल बी वेरी रेलेवेंट फॉर यू इन दैट सेंस. All right. Then we go further. We now talk rural economy. So government has been prioritizing rural areas. Mind you, Dr. Kalam ने बोला था पूरा providing urban amenities to rural areas because majority of India's population lives in rural areas and that will give us equitable growth. So infrastructure is based on rural housing, Jal Jeevan Mission, drinking water, Swachh Bharat Yojana, sanitation, biogas, clean fuel, connectivity like PM Gram Sadak Yojana, and livelihoods like employment programs. Then microfinance provisions has been given. तो microfinance का मतलब क्या है? Small units giving loans and accepting sometimes money from a small group of individuals. That is microfinance. 500 people, 1000 people, targeting it like that. Self-help groups, I'm sure you have heard of it from me earlier, and financial intermediaries. तो इनको develop करिए, train करिए, लोगों तक लेके जाइए. Then of course, digitization and technology, enhanced agriculture, governance and land management, like Swamitwa for digital land records or drones for spraying in agriculture. So using that digital technique. And then healthcare focus to improve rural well-being. तो रूरल इकोनॉमी में इंप्रूवमेंट इन क्वालिटी ऑफ लाइफ इंडिकेटर्स में क्या क्या देखने को मिला, ये आप याद रखेंगे. डेवलपमेंट इंडिकेटर्स ऑब्जर्व्ड in rural economy. All right, that is what we are focusing on. So we see 11.57 crore toilets and 2.39 lakh community toilet complexes were constructed under Swachh Bharat Mission Grameen. Remember that, 11.5 crore toilet and 2.39 community toilet. Similarly, 11.7 crore households provided tap water connection under Jal Jeevan Mission, and under PM Awas Grameen, 2.6 crore houses were constructed for the poor in the last 9 years. 10.3 crore LPG under PM Ujjwala, 21.4 crore rural households electrified under Sehaj Bijli Har Ghar Yojana, which is Saubhagya, and 4.29 lakh common service centers functional as of July 24. And 15.14 lakh kilometer of road constructed under Gram Sadak Yojana. ये बॉक्स जो आप देख रहे हैं, ये आपके लिए गोल्ड माइन है ऑफ डेटा फॉर राइटिंग योर आंसर, सजेस्टिंग व्हाट स्टेप्स हैव बीन टेकन एंड इम्पैक्ट हैज बीन ऑब्जर्व्ड ऑन रूरल डेवलपमेंट इन इंडिया इन द लास्ट 10 years. You can make a lot of good answers out of this. Then of course, banking and financial inclusion, 9.7 crore beneficiaries registered under RRBs, 0.19 crore beneficiaries under rural cooperative banks, and 465 lakh beneficiaries new Kisan credit card application, and more than 104 crore beneficiaries under DBT. Again 35 crore plus RuPay debit cards, and the PFMS e-Gram Swaraj integrated with over 2.63 lakh panchayats out of 2.79 lakh onboarded for payment transaction. So this is for financial inclusion. तो ये क्या आंसर कर देगा? Financial inclusion in rural areas, empirical evidence. And then of course education, rise in school infrastructure like Samagra Shiksha Abhiyan, इसकी बात हम पहले भी कर चुके हैं, digital learning through free online channels. Then roads, Pradhan Mantri Gram Sadak Yojana, 8,34,000 kilometers of road length sanctioned, 7,70,000 completed. So 99.6% of targeted habitations now are provided with connectivity. 2.69 crore houses completed under PM Awas Yojana, and 68,843 Amrit Sarovars, that is ponds, for localized irrigation facility and drinking water facility constructed under mission Amrit Sarovar. Then of course there is health infrastructure, National Health Mission that has been done in rural areas, which we have already majorly talked about, but 32.9 doctors at PHCs, 4.4 total specialists. So this is about what has it done for health, drinking water, and so on. Then sanitation, we have already discussed it, 11.8 crore toilets. And then that means under Sansad Adarsh Gram Yojana, we have 3,300 gram panchayats adopted by MPs, 3,120 gram panchayats uploaded village development plans, and 2,30,000 projects have been completed. So we see all this. Then of course there is construction of road for PM Janman, Janjati Adivasi Nyay Mahabhiyan, which has been done. So the idea is that the PVTG habitations with 8,000 kilometers of road will be provided connectivity under PM Janman Yojana. That's an addition to PM Janman. तो जो मैंने तुम्हें क्लास में लिखवा रखा था नोट्स में, उसमें ये ऐड कर लेना कि apart from other benefits, road benefit has also been extended now in this PM Janman Yojana. Then of course we have PM GSY phase 4. ये 2024-25 के बजट में अनाउंस हुआ. ये डिटेल अपने नोट्स में ऐड कर लेना जो मैंने ग्राम सड़क योजना में लिखवाया था. All weather connectivity to 25,000 rural habitation based on census of 2011, use of GIS technology for survey, international benchmark and good practices in construction, and PM Gati Shakti will be used for planning and implementation. So this has been announced in July 2024, implemented from April 2025. Then of course for housing, we have already said that rural housing gives you a social status, durable credit asset, and drives local employment because construction will need people. The PM Awas Yojana Grameen, they have given a particular paragraph on that. It was launched in April 2016, aligns with the Sustainable Development Goal 11 of safe and affordable housing. And what is the objective of PM Awas Yojana Grameen? To provide Pakka house with basic amenities to all homeless and Kacha house families in rural areas by 2029. And since 2016, 2.69 crore houses have been built with a target of 2 crore more in the next 5 years. So targeting is done on the basis of socio-economic caste census 2011. We need to update it. Awas Plus survey 2018 is not as much complete. So sometimes there is, if you ask me, wrong allocation also. आपने भी खबर देखा होगा, बहुत जगह देखते होंगे आंख से अपने कि बहुत लोग क्या कर रहे हैं, अपना बने हुए घर का फोटो खींच के उस पर फिर से पैसा सैंक्शन करवा ले रहे हैं. So these are challenges of misallocation of resource also that we observe in PM Awas Yojana Grameen. Of course, then we go further. Then there is, it goes beyond housing. The National Institute of Public Finance and Policy Evaluation study shows that the direct benefit transfer along with geotagging has reduced delays in fund allocation and improved financial inclusion. And the region-specific housing design, Pehel, a repository of housing typologies, made sure that proper type of material and housing benefits can be given to people. Then Rural Mason Training Program was also introduced. So this was with partnership of Construction Skill Development Council of India and National Skill Development Corporation to improve availability of skilled masons. Mason Raj Mistri ko bolte hain. So skilled mason who will make sure that housing can be done faster and good quality. So 2.8 lakh masons have been trained and certified, which will mean that faster work will be done and income will also be created for people. Of course, average construction time has declined from 314 days to 114 days. As I said, employment generation has been tremendous for skilled, semi-skilled, unskilled workers, and it estimated 192 crore skilled and 250 crore unskilled man days have been generated as employment. The transparency part says that Awas Soft, MIS and Awas app facilitate implementation and evidence-based monitoring. कर रहे हैं, लेकिन जहां पर पंचायत में ही करप्शन आ जाए या बीडीओ साहब थोड़ा करप्ट हो गए, वहां गड़बड़ हो रही है अभी भी. आई विल अगेन इंसिस्ट. सर्वे तो खैर सरकार के लिए अच्छी बात बोलेंगे, आई वोंट स्टॉप देम, बट ऑन द ग्राउंड द रिसर्च इज नॉट वेरी पॉजिटिव इन सम एरियाज, नॉट ऑल ओवर इंडिया. इट इज एन इम्प्रूवमेंट, बट वी आर स्टिल स्ट्रगलिंग. और ये जितनी बात हो रही है अबाउट AI/ML, that is आर्टिफिशियल इंटेलिजेंस, मशीन लर्निंग बेस्ड प्रोजेक्ट डिटेक्शन एंड जियो रेफरेंसिंग, ये बहुत ही कम जगहों पर है अभी. तो जब ये बढ़ जाएगा, स्केल अप हो जाएगा, we can think in terms of removing duplication, improving targeting, but right now if you ask me, we are still struggling. हाँ, inclusiveness जरूर अच्छा है. The scheme reserves 60% target for scheduled caste and scheduled tribes, completing 59 lakh scheduled caste and 58 lakh scheduled tribe houses, and 5% is reserved for differently abled and 5% for families affected by disasters. So 74% houses are owned by women solely or jointly. ये आप जरूर लिख सकते हैं on ग्रामीण आवास योजना as a benefit. And it integrates with Manrega and Swachh Bharat Mission Gramin, Jal Jeevan Mission and Surya Ghar to provide water, toilet, LPG, electricity, solar energy and so on. So there will be a holistic benefit for people under Awas Yojana Gramin. 88% beneficiaries reported improved living standards under this scheme. Now localizing SDGs we are looking at. So क्या है ये? It is the process of adapting and customizing the sustainable development goals and translating them into local development plans. कि बड़ी strategy है sustainable development goal, लेकिन हर area के अपने challenges हैं, and every area will have its own resource constraint, will have its own resource benefits also. So how to make sure we localize the sustainable development goal is now the thing that the government is picking up. So now we see, since adopting the sustainable development goals in 2015, India has actively pursued their implementation through voluntary national reviews in every 3 years and adoption of SDG index. And the vision of Viksit Bharat makes sure that we are moving towards that index, with state governments also playing their own role. And then we are also focusing on aspirational district programs transformation, and then local indicator framework, and even aspirational blocks program. At state level, state governments have actively integrated sustainable development goals into local governance by extending indicator frameworks. That district and block level, the indicators of SDG are now checked कि कौन से district कहाँ पहुँच गए, हर district में block कहाँ पहुँचा, तो उससे एक real time data मिलता रहता है, updation मिलती रहती है that how many targets have been achieved in which direction. So that all we are now able to observe. India's SDG localization model is based on 4 key pillars. 1. Institutional ownership. कि जो भी इंस्टीट्यूशन बनेगा, जैसे पंचायत चलाएंगे उसे, या कम्युनिटी वेलनेस सेंटर्स चलाएंगे, या सेल्फ हेल्प ग्रुप्स बनाएंगे, सो इंस्टीट्यूशनलाइज्ड ओनरशिप वेरी इंपॉर्टेंट. संस्थागत आत्मीयता होने पे क्या होता है कि जब लोग एक संस्था के थ्रू, इंस्टीट्यूशनल के थ्रू ओनरशिप रखते हैं, कंटिन्यूटी इज मोर. Then collaborative competition, people can compete with each other by collaborating with each other. People here means districts and blocks and so on. Capacity building, making sure people are made enabled to grow better, and a whole of society approach. It should not be in bits and pieces. It should be whole of society. कोई छूटना नहीं चाहिए, सभी cover हों. That is the basic idea. हाँ राहुल, गर्मी में चाय पीने की इच्छा हो रही थी मेरी, क्या बताऊँ तुम्हें. Actually it's for throat, Rahul. The throat has still not fully picked up. तो कुछ warm जाता रहता है. It's green tea kind of a thing which keeps the throat soothed down. नहीं तो मैं चाहता नहीं हूँ कि वापस 7 दिन के लिए मुझे बिठा दे. Okay. SDG coordination centers भी बनाए गए हैं. They operate in 10 states and UTs, driving implementation through integrated policy making, monitoring and stakeholder participation. साथ में the centers have fostered result based planning, कि सिर्फ प्लान नहीं किया, result based planning की, evidence based decision making लिया कि अच्छा ये काम किया, इसका ये result आया, ये evidence देखने को मिल रहा है, तो तब decision लो कि आगे का plan क्या बनना चाहिए. And targeted interventions. 2030 is the time when we need to make sure we have achieved our sustainable development goals. So the National Institution for Transforming India is transitioning into SDG coordination and acceleration centers. The idea is improve people's participation, create institutional support, promote planned development, and you upgrade people. Then of course, Kerala model of SDG localization has been discussed by survey. It says Kerala employs a strong community driven approach integrating SDGs into local governance through awareness program and stakeholder training. Stakeholder training का मतलब क्या है? जो beneficiaries हैं उनको train करिए कि इससे कैसे benefit मिलेगा. So stakeholder training is that train the beneficiaries how they will get benefited out of the program. The local self-government department and Kerala Institute for Local Administration have developed guidelines for SDG aligned planning and data collection. So data quickly collect होता है, planning बेहतर होती है, and they can achieve their targets much better. And the real-time SDG dashboard monitoring happens. So panchayat progress in a data-driven decision-making then can take place. And that is the benefit of involving the state and involving the stakeholders. तो ये ज़्यादा transparent होता है, growth better होती है. Other states can follow that. Then other measures towards rural welfare. One is of course food, nutrition, health and wash. That is promotes nutri gardens, poultry, dairy, etc. Social inclusion and gender. 32 state rural livelihood missions have been implemented. Gender focus, child education, early marriage को रोका जाए. Then gender resource centers बनाए गए हैं around 4,000 across 18 states with gender point persons. The basic idea is to make sure that women get their due in the patriarchal system that India is. Also, legal access is being provided through NALSA, free legal aid and awareness with Gram Nyayalayas for disposing cases faster. And social security through NSAP has been given for supporting more than 3 crore BPL beneficiaries with pensions complemented by state schemes covering an additional 5 crore, ensuring 9 crore total beneficiaries under an estimated 1 lakh crore safety net. So pension benefits, other social security benefit, around 1 lakh crore safety net for more than 9 crore people. Then of course, rural income enhancements. One is National Rural Livelihood Mission. This was launched in 2011 and it aims to reduce poverty by creating wage employment, skill development, self-employment. इसके लिए क्या क्या किया गया? पहला, women led institutions through community, जो community हैं उन्हें mobilize किया गया. जो लोग रह रहे हैं, देख रहे हैं, उन्हें mobilize किया गया कि आप अपनी मदद पहले तो खुद करिए. Self help yourself. Then of course they're managed by women who are mostly in the rural areas because men can sometimes go out for migrant work. Then financial inclusion has been focused upon, credit, other financial services. Sustainable livelihoods have been focused upon, diverse income opportunities like integrated farming, diverse income opportunities like focusing on developing small services sector, entertainment kind of services being developed and so on. And then focusing on inclusion and entitlements. So the basic idea is make sure that people have their own system, the women can get new enterprises, including solar powered sanitary pad production, soaps, detergent and fencing materials. एक ही जगह production हो, वहीं locally distribute हो, लोग थोड़े income earn कर लें. But मैं फिर repeat करूँगा, इसके साथ ज़रूरी है बेहतर nutrition, बेहतर education, so that next generation को फिर यही काम ना करना पड़े, वो इसके आगे जा सके. That should always be the talking point. Then of course, we talked about capacity building. It has mobilized more than 10 crore rural poor households and financial inclusion for 1.3 lakh self-help group women's, 49,000 crore of capitalization support provided to self-help groups and 9 lakh crore plus of bank credit assessed by self-help groups. More than 2.6 crore households are now under agri-nutri and nutri gardens and more than 36,000 custom hiring centers. ये custom hiring center क्या करते हैं? Tractor, drones, other machines, harvesters. ये अगर किसी को किराए पे चाहिए तो आप custom hiring center से जाकर ला सकते हैं. And then of course 4.3 crore महिला किसान have also been covered. For non-farm livelihood, Startup Village Entrepreneurship Program has been launched and more than 3 lakh enterprises in 280 blocks have now been established. And Ajivika Gramin Express Yojana has been established, जिसमें 2297 vehicles अब operational हैं in 26 states connecting the remote villages. तो लोगों को पैसा खरीद के ऑटो खरीदवा दिया या ई-रिक्शा खरीदवा दिया या टैक्सीज खरीदवा दिए and they're connecting the villages. So that is the basic idea again. Now when we talk about initiatives, Lakhpati Didi initiative, ये मैंने आपको क्लास में ही पढ़ाया था, to uplift 3 crore self-help group households to an annual income of 1 lakh within 3 years through diversification of livelihood and capacity building. Then Saras Ajivika portal and eSaras app, it provides an online marketplace. Mind you, the Saras Ajivika portal provides an online marketplace कि जो self help group made handicraft products हैं जैसे apparel, furniture, pickles, that will help in rural entrepreneurship development and alternative employment. And then rural self-employment training institutes, they are bank managed training centers. ये banks इनको manage करते हैं, यहाँ training मिलती है लोगों को. They offer free skill training, credit assistance, loan मिलता है, and mentorship to rural youth between 18 to 45 years. Since 2009, 50 lakh people have been trained, 36 lakh have been settled as entrepreneurs with a 72% सक्सेस रेट. ये एग्जाम्पल जरूर याद रखो. जितने ये एग्जाम्पल याद रखोगे उतना ज्यादा आप कोट कर पाओगे अपने आंसर्स में और रेलेवेंट बातें लिख पाओगे ऑन इंक्लूसिव ग्रोथ. देन ऑफ कोर्स, हाउ आर वी फाइनेंसिंग द रूरल एंटरप्रेन्योरशिप? So NABARD supports them via microeconomic development program and livelihood and enterprise development program. March 2023 तक 5.8 lakh self-help group members benefited from 52 crore micro enterprise entrepreneurship development program, and 2.6 lakh members benefited more than 106 crore from livelihood and enterprise development program. Off-farm producer organization received support to join ONDC for digital commerce. सरस मेला लगाया गया, the initiative by Ministry of Rural Development, ताकि सेल्फ हेल्प बेनिफिशियरीज डायरेक्टली जाकर बेच सकें इन अर्बन मार्केट्स. मिडलमैन को बाईपास करने का तरीका है, प्रॉफिट मार्जिन्स बढ़ाने का तरीका है. देन ऑफ कोर्स DDU ग्रामीण कौशल विकास योजना, दैट इज ऑलवेज देयर फॉर एनहांसिंग स्किल डेवलपमेंट इन रूरल एरिया and for career growth. 16.5 lakh people have been trained in it and 10.4 lakh have been placed in it. They have special sub schemes like Roshni and Himayat for supporting specific regions, mainly for the minority groups in India. Then of course, for case study, they talk about can scale into larger enterprises. अगर प्रोफेशनल सपोर्ट दिया जाए, वहां वो एक एग्जाम्पल देते हैं, डूंगरपुर या राजस्थान में एक जगह है, ट्राइबल women successfully owned and operated solar lamp factories with guidance from Professor Chetan Solanki of IIT Bombay and support from Ministry of New and Renewable Energy. So अगर प्रॉपर ट्रेनिंग दी जाए, गाइडेंस दी जाए, तो जो women self help groups हैं वो इनिशिएटिव्स ले सकते हैं फॉर डेवलपिंग दीज प्रोग्राम्स. देन ऑफ कोर्स मनरेगा के बारे में बात है, अगर अपने नोट्स में ऐड कर लोगे, that मनरेगा has enhanced rural livelihood security. And how has it done that? तो अगर तुम देखोगे person days generated in work generated 2024-25, is till January 25, but otherwise if you see, it has generated more than 300 crore of person days, and average person days per household has been almost 50 days, and women participation rate has been consistently above 50%. So we see some efficiency reforms in Manrega. Geotagging before, during and after the work is now completed. Second, 99% payments are via NEFMS, DBT wage transfers and Aadhaar based payment, and 96% of active workers are now beneficiaries. And social audit units operate in 28 states and UTs to ensure transparency. These are good things again. Corruption can be controlled, targeting can be better, and better quality structures will be created under Manrega. Then of course, Manrega is also now targeting towards rural asset creation. अब देखिए, the work on individual rural land rising from 16.2% to 71.2% in fiscal year 25. So it enhances soil quality, plantations and water management through integrated waters management assets. So that is again something that Manrega is doing. मतलब कहने का क्या है, पहले मनरेगा क्या करता था, जॉब तो देता था बट रूरल स्ट्रक्चर्स क्रिएट नहीं होते थे. तो एक क्रिटिसिज्म इसकी होती थी कि गुड क्वालिटी स्ट्रक्चर नहीं हो रहे हैं. सो द एफर्ट इज बीइंग मेड दैट ओके, अपार्ट फ्रॉम गिविंग जॉब्स, लेट्स ट्राई क्रिएटिंग रूरल स्ट्रक्चर्स. ऑफ कोर्स विद बेयरफुट टेक्नीशियंस होते हैं लोग जो ITI में ट्रेंड हैं, या कंपैरेटिवली लेसर ट्रेंड हैं, बट इतना जानते हैं जो कैपेसिटी बिल्डिंग कर सके. And then Manrega has now been integrated with other schemes like nutri gardens, fodder farms, horticulture, medicinal plantations and sericulture. Along with that, Gram Panchayat buildings, rural road, aquaculture. So all that is improving Manrega's position now and creating value addition jobs, better quality jobs. But सच्चाई में क्या हो रहा है अभी भी बहुत जगह पे कि ठीक है ये बातें हैं लेकिन अभी भी ये बहुत पॉपुलर नहीं हुए हैं. So we still don't see too many people getting enrolled or getting employed under Manrega in these. ये सर्वे तो बोल रहा है ये सब हो रहा है, पर अगर आज भी आप गांव में जाएंगे तो बहुत सारे गांव है भारत में जहां गड्ढे खोद रहे हैं, गड्ढे भर रहे हैं. So this is something that we need to work upon. और यहाँ डेटा लाना चाहिए हमें धीरे धीरे that okay, for this holistic rural growth, how many fodder farms could be connected, how many nutri gardens we could create, how many horticultural products could come under this. So if we can do that, then I think we will reach a much better result for Manrega. अब ये स्टेट वाइज डिस्पैरिटी आप देखिए फंड एलोकेशन फंड यूज में. तमिलनाडु with 1% of the poor in India received 15% of Manrega fund. Kerala with 0.1% of the poor in India used 4% of Manrega fund. In contrast, Bihar and UP with 45% of poor in India could receive only 17% of the funds because they didn't make efforts to use these funds. So that is where correlation between poverty and fund allocation is just 0.3, a very weak link. तो हम देखते हैं कि comparatively worse off states ने कम fund use किया, better off states ने ज़्यादा कर लिया, which is worrying. Ideally the worse off states should get more benefit, but that will happen only when they do the projects on time, create transparency and make sure they are attached to central government portal. The weak correlation, as I already told you. Now what is the factor? As I told you, the Manrega work demand does not directly correlate with rural distress. The scheme has evolved from a last resort employment option to a tool for household asset creation and income generation. लेकिन एक और कारण है, बिहार और यूपी में मनरेगा की वीकनेस की वजह से यहाँ के वर्कर्स केरला, तमिलनाडु, महाराष्ट्र, गुजरात, पंजाब यहाँ चले जाते हैं. So the demand for Manrega work is less in these states. The workers from other states are not migrating as much, so their demand remains high. तो asset building का हो गया सब कुछ. मैं मानता हूँ इकोनॉमिक सर्वे की बात that the scheme has evolved from a last resort employment option to tool for household asset creation. आप ये लिख भी सकते हैं, but apart from that, it is also a program where the poorer states have a lot of out migration and hence less demand compared to the richer states which have relatively high demand with less out migration. And then the institutional capacity, मैं यही बात बोल रहा था, states must finalize labor budgets, conduct ग्राम पंचायत meetings, submit utilization certificates. तो जो states ये better करते हैं और ज़्यादा punctual हैं, they get more results from Manrega. Stronger institutions execute costlier projects, while poorer states rely more on lower cost individual works. तो जो stronger institutions हैं, तमिलनाडु, केरला, ये actually asset building करने लगे. और जो पुअरर स्टेट्स हैं ये अभी भी वर्कर्स को गड्ढे खुदवा रहे हैं, गड्ढे भरवा रहे हैं. दैट इज द चैलेंज वी आर हैविंग. देन ऑफ कोर्स हायर इनकम स्टेट्स हैव बेटर इंस्टीट्यूशंस, यूज मोर फंड्स पर वर्क एंड दैट इज रिफ्लेक्टेड इन पुडुचेरी एंड यूपी डिफरेंस. पुडुचेरी यूजेस 8 लाख रुपीस पर वर्क, यूपी डजंट इवन यूज 1 लाख पर वर्क. तो ये आप बताएंगे that these are the challenges now faced at Manrega, why poorer states are unable to tackle this challenge. Then of course work demand registration issue is there. The legal provision for unemployment allowance is there. Only 90,000 was paid in 94 because demand registration could not take place on time. So demand is often underreported since work requests are logged only when employment is provided to avoid state liability. ये cheating कर रहे हैं अपने लोगों के साथ हम. नियम ये था कि अगर आप लोगों को जॉब नहीं दे पाएंगे तो उस केस में आपको उन्हें unemployment allowance देना पड़ेगा. If you are unable to provide jobs to your people, you will have to give them unemployment allowance. But states ने क्या बदल दिया है इसमें? Only when people get employed under Manrega are they registered, so automatically then compensation paid will be less. So they are not registered for demanding job till they are not, till they are not employed under Manrega. So we see that the work demanded on the portal is definitely equal to work given. Social audits ने ये reveal किया है that 935 crore has been misappropriated over 4 years with issues like fake cards, contractor exploitation, machine use instead of labor. Also, anecdotal evidence suggests that funds intended beneficiaries तक नहीं पहुंच रहे हैं, क्योंकि लोग बीच में ही मिली भगत कर लेते हैं और सरपंच जी के जो क्लोज हैं, रिलेटिव हैं, वहां तक बात पहुंच जाती है, फाइनल लोगों तक नहीं पहुंच रहा. So this is good survey is highlighting it. It will allow the states and the central government to take some major steps in controlling this leakage. Then of course digital transformation is happening at the grassroots. We see that digitization is serving as a powerful tool with a 200% rise in rural internet subscription. It is still low, but the rise is there. E-Panchayat Mission Mode project has been there. So it automates workflows for 2.7 lakh panchayats, allowing 30 lakh elected members and 10 lakh functionaries. So this is the benefit they are getting. Another is E-Gram Swaraj. That is, it was launched in 2020. It digitizes Gram Panchayat profiles and finances and development plans. So that means easily the data can be updated, achieved, and benefits and the efforts can be seen. Then there is Bhu Aadhaar, that is, UL PIN. It's a 14-digit unique land ID based on geo coordinates, facilitating land demarcation and service integration. तो इससे क्या होगा कि 29 स्टेट्स में रोल आउट कर दिया गया है और 14.9 करोड़ यूएल पिन्स हैं. तो जो लोग जमीन में धोखाधड़ी करते हैं, बेच देते हैं, वो कम होगा. लैंड बैंक्स बनाए जा सकेंगे, लैंड पूलिंग करके इंडस्ट्रियलाइजेशन की जा सकेगी. सो दिस इज द बेनिफिट ऑफ getting the proper record done. And then of course Swamitva scheme, it was launched in 2020 to provide property rights to rural households through drone surveys. It aims to enable property monetization, कि लोग अपनी प्रॉपर्टी बेच सकें, disputes कम हो सके और अपने नाम पे म्यूटेट करवा सके, अपने प्रॉपर्टी को अपने नाम से रजिस्टर करवा सके. And then it completed in 2.9 lakh villages, issuing 1.66 crore cards across 1.06 lakh villages. But still a lot of work has to be done here. We are hardly completing it in 1/6 of the total villages in India. तो यहाँ बहुत काम की requirement है अभी भी. Swamitva has not progressed as it was envisaged. Then the focus on empowerment of women. Gender budgeting has been increased from 97,000 crore to 3 lakh crore. That's a 218% increase. And in share in union budget now has reached 6.5%, the highest since gender budgeting statement began. The idea is to achieve women-led development, give them access to sanitation, water access, menstrual hygiene, and so on. What are the steps government has taken? One is Beti Bachao, Beti Padhao. It has improved awareness with sex ratio at birth rising from 918 to 930. Maternal mortality rate has dropped from 130 to 97. This we have already discussed. And savings have happened through Sukanya Samriddhi scheme up to rupees 2 lakh in the name of the girl child, subsidized by the government. Then Janani Shishu Suraksha Karyakram and PM Matru Vandana Yojana, helping the women in deliveries, and institutional deliveries have now increased from 78% to 88.6%. ये अच्छा achievement है, but अभी भी सोचिए 11% deliveries are happening without an institution behind it. Trained medical professional के बिना आज भी इंडिया में 11% डिलीवरीज हो रहे हैं. तो 100 में से 11 बच्चे आज भी जन्म ले रहे हैं without trained medical professional. That is something we should get worried about. Then of course cash incentives for the mother and public health benefits. Nutrition and health is given through Anganwadis, Mission Saksham Anganwadi. पोषण 2.0 टैकल्स malnutrition. मैं अभी आपको पोषण स्कीम पढ़ाऊंगा परसों, जब आप मंडे को जब मैं आपसे मिल रहा हूं फॉर करंट अफेयर क्लास. नाउ पोषण 2.0 टैकल्स malnutrition through life cycle based nutrition. What is that? Give nutrition initially to the child when it is born, then give nutrition in pre-adolescence, something like integrated child development mission, then in the school midday meal mission, then after school through the PM Garib Kalyan Yojana, and so on. All right, then shifts focus beyond calorific sufficiency. सिर्फ कैलोरी पे ध्यान मत दीजिए, माइक्रोन्यूट्रिएंट्स पे दीजिए, आयरन, कैल्शियम एंड सो ऑन. साथ में आंगनवाडीज को मॉडर्नाइज किया जा रहा है into सक्षम आंगनवाडीज फॉर अर्ली चाइल्डहुड केयर with workers equipped with smartphones and Poshan Tracker app. They have given Odisha's case study in this, that Janch and Mother committees at village levels monitor the ICDS, Integrated Child Development Scheme, ensure quality of meals is good, and extract accountability to make sure, see, these schemes are all good. ये भारत में आज 40 साल से ऐसे स्कीम्स हैं, इनकी डिलीवरी मैकेनिज्म पे क्वेश्चन मार्क है. सो इफ वी यूज टेक्नोलॉजी, रियल टाइम कैमरास, achievement of indicators, we will be able to implement these schemes much better. Then of course there are gender specific challenges through Swachh Bharat mission. Women can now use toilets, clean cooking gas and tap water. So women's burden has been reduced and workforce participation via National Rural Livelihood Mission is increasing. Then of course Sakhi centers to provide legal, medical and shelter aid for women, and education and skilling for women. Gross enrollment ratio in higher education is now higher after Sarv Shiksha Abhiyan and right to education. Like females today have a higher gross enrollment ratio than males. That's quite an interesting change in India in the higher education. And rising girls' education now will translate into employability, economic empowerment only when workforce participation rises, and that will need infrastructure support and policy support. Then of course women's participation in skilling schemes has risen significantly. Pradhan Mantri Kaushal Vikas Yojana mein now there are 52% women, Jan Shikshan Sansthan 82% women, and ITIs etc. now 13% women compared to 9.8%. But remember, the success will require supportive infrastructure like safe transport, child care and career counseling. अगर ये करेंगे तो women की success ज़्यादा बढ़ेगी. Now साथ में India leads in female STEM graduates, that's science, technology, engineering and maths, 42.7%, but their representation in R&D is low. Also ये 42.7% number quality को reflect नहीं करता, quantity को करता है. So the focus should be on quality also. Then of course initiatives like Wise Kiran support women scientists, and Vigyan Jyoti addresses underrepresentation of girls in STEM courses. Women's leadership in Chandrayaan 3 and Aditya L1 highlights the progress, and enabling policies are allowing women to in fighter pilot roles, commandos, etc. तो कभी आप gender equity पे लिख रहे हैं, this will become a very good point as to steps taken by the government and achievements till now on gender equity. Of course, Nari Shakti Vandan Abhiyan 2023 mandates 1/3 reservation for women in legislatures, but then of course government has said this will happen only after delimitation has been completed. 1991 reservation of 1/3 of panchayat seats. Now women make up 46% elected representatives in panchayat, but यहाँ भी पंचायत प्रधान में प्रधानपति का concept है इंडिया में, where the husband of the panchayat head sometimes also calls the shots. तो ये नहीं कह रहा हूँ ये गलत बात है या खराब बात है. They are good achievements, but survey हमें इसका दूसरा side नहीं दिखाता, तो मैं आपको उसका दूसरा side भी दिखा रहा हूँ. Nothing else. That survey doesn't tell us what exactly. The numbers look great, but is the quality also equally great? Is what India should be continuously asking. And now we talk about identity and financial inclusion. In 1952, 28 lakh women registered to vote as wife or mother of someone, leading to invalidation of voter IDs. Today, women's independent identity is reinforced through initiatives like ration card in women's names, that is through National Food Security Act, joint or single house membership, Jan Dhan Yojana, 25 crore women are now banked, and collectivization of 10 crore women under self-help groups. Then we talk about labor force participation rate. Women's labor force participation has risen from 23% to 37%, driven largely by rural India, with 75% women in workforce. यहाँ पे हंस रहा हूँ इसलिए मैं, because they are women who are in unpaid work. इनको पैसे नहीं दिए जा रहे, फैमिली के लिए काम करने को कहा जा रहा है, क्योंकि अब कोविड के बाद स्पेशली दिक्कत बढ़ गई, कमाई नहीं हुई, तो women को वापस काम पे आना पड़ा. ऐसे women labor force participation नहीं बढ़ाना है. Skilling women, training them, creating entrepreneurship, promoting their availability of their presence in the workspace, ऐसे women का बढ़ाना है presence. ये नहीं कि अच्छा मजदूर कोई नहीं मिला, चलो women से घर का भी काम कराओ, मजदूरी भी करा दो. तो सर्वे ने बड़े अच्छे से बोल दिया 23% से 37%. मैं आपको इसके बाद बताता हूँ. And I'm claiming labor force participation rate here, the data from periodic labor force survey. 11% increase out of this 15% shown by survey, 14%. 11% increase is in the unpaid work, and that is something we should get worried about. ये women empowerment नहीं है फिर. So we have to get worried about that part also. Then of course for higher value addition, opportunities in sectors like agro processing must be expanded. ये एक बात सही कहे हो. And Krishnagiri district of Tamil Nadu का example दिए. वहाँ पर electronics, automobile, footwear इन सब की factories हैं, और यहाँ तमिलनाडु गवर्नमेंट ने proper steps लिए हैं, creating hostels for women, setting up factories near the villages so that women can come work and go back, creating skill development and training for the women. So the Krishnagiri district then has seen some wonderful results. They've previously faced high child marriage rates, prenatal sex selection, now low female literacy was seen. The district has seen a shift once manufacturing job has come and women have been empowered. So families now view girls as assets rather than liability. It has reduced child marriage, dropout rates have been reduced, and female enrollment in polytechnics, that is training institutes, has become relatively higher. So that is the benefit that we see across. Then of course financial inclusion and entrepreneurship, ये हम पढ़ ही चुके हैं. जनधन योजना के 55% beneficiaries women हैं. National Rural Livelihood Mission में 89 million women in 8.3 million self-help groups have gained financial independence. And success stories include Kudumbashri in Kerala, Jivika in Bihar, महिला आर्थिक विकास and so on. अच्छी बातें हैं, याद रखोगे, but जैसा मैंने कहा, much more has to be done on women empowerment than what we have done till now. In entrepreneurship, 68% of PM Mudra Yojana loans are with females, and 77% of Stand Up India beneficiaries are females. So women-owned enterprises currently have 17 to 20% of total businesses, and it is expected it can grow up to something like 1/3 by the Bain company. Equality of asset ownership is still a challenge. Land and property rights are crucial for financial security, but we see that despite legal provisions, only 14% of landowners are women. So this is a challenge we still see. And PM Awas Yojana mandates female house ownership, but true progress requires societal shift. Women के नाम पे है भी अगर property, वो control नहीं कर रहे अपने property को. The control is still with the man of the family. So that is again something we should be careful about. All right. Sustainable development, now 6 years left to achieve the SDGs. India remains committed, as they say, and we have already discussed Niti Aayog has become a place for targeting them, with the country's score is now rising from 57 to 71 in 2023-24. So the targeted initiatives like Awas Yojana, Ujjwala Yojana, Swachh Bharat Abhiyan, Ayushman Bharat are keeping India on track of achieving sustainable development goals. So we see India's progress in sustainable development goal. SDG 1, no poverty, 72 is our score. In zero hunger, 52 is our score. Good health and well-being, 77 is our score. So if you see over these, the score has been increasing. If you see here also, the scores have been increasing in all these. और ये बहुत important chart है again. इसको अच्छे से देखोगे. कुछ चीज़ों में अगर आप देखेंगे, clean water and sanitation 89, that is because of Jal Jeevan Mission and Swachh Bharat Yojana. Affordable energy 96 because of Sehaj Bijli Har Ghar Yojana. These are places where government has worked, it has created the result. Sustainable cities 83 score. So you see high scores in places where government has worked. We have to get a little worried about gender equality per se, which is still giving us a relatively lesser score. The states have been divided into aspirant, performer, front runner and achiever. So at the moment we have nobody in achiever, but there are states that are there as front runners and achievers to some extent. We see between 2018 to 23-24, the fastest moving states include Uttar Pradesh, 25 increase in score, Jammu and Kashmir, Uttarakhand, Sikkim, Haryana, Assam, Tripura and Punjab, with Madhya Pradesh and Orissa backing up. अब देखिए ये सस्टेनेबल डेवलपमेंट का हमारा स्टेट यूनियन टेरिटरी वाइज परफॉर्मेंस है. तो आप देखेंगे यहाँ हमारा बहुत सारा पॉपुलेशन कंसंट्रेटेड है और ये अभी भी अपने आप को एस्पिरेंट बता पा रहे हैं बेचारे. द स्कोर लेस देन 50, बिहार, उत्तर प्रदेश. Similarly, performers are majorly there, and if you see Tamil Nadu and Kerala, they are showing front runner status. Assam is another place lagging behind. We need to actually do much better than what we are doing at the moment, and these are the places we should focus more. They are low hanging fruits. I hope the scheme of Purvodaya will help in making these places much better developed. So the outlook given by survey is that it prioritizes inclusive growth and last mile benefits, bridging the learning gap, preventive healthcare being practiced with national health policy, strengthening rural infrastructure, regulatory frameworks being established, and a scheme is however well designed and noble in its formulation and is only as good as its implementation. ये सर्वे बहुत इंपॉर्टेंट बात कह रहे हैं. तो अगर हम चाहते हैं अच्छा रिजल्ट आए तो हमें उनके इम्प्लीमेंटेशन पे ध्यान देना होगा. सोशल सेक्टर बहुत ही इंपॉर्टेंट चैप्टर है, लगातार पूछा जाता है आपसे, ध्यान रखेंगे आप. आई एम मीटिंग यू टुमारो अगेन at 12 o'clock in the morning, at noon, and we will finish the next chapter then. Thanks a lot for continuously supporting. I love you all. All the best. Bye-bye.